HealthLink on New Day Northwest is sponsored by the Polyclinic.
At the Polyclinic, physicians are able to work side by side, collaborating and saving lives. That's exactly what happened during a routine exam for a patient named Ed Williams. When his doctor noticed signs of possible heart attack, he was able to walk down the hall and seek help from his colleague, a cardiologist. From there, Ed got the right test the same day, a process that could have taken weeks or might have required a trip to the emergency room. Today, we're going to talk to Ed, but first, let's meet his team of doctors from the Polyclinic, primary care physician Dr. Thomas King and cardiologist Dr. Kier Huehnergarth. Nice to meet you both. Did I pronounce that correctly?
You did.
Okay, very good. Dr. King, tell me, when Ed came in for his appointment, what happened?
He'd had a couple of weeks of chest symptoms that he initially didn't think was related to his heart, but he started to recognize that they were accelerating and more related to physical activity. And that caused him to decide to make an appointment. And we saw him one morning, and he kind of related this story to me.
And then what happened after that?
Well, it was kind of a concerning story, so I did a few preliminary tests, but most of the time what people tell us, the answer is there. And I was concerned enough to contact Dr. Huehnergarth and walk Ed down the hall and kind of let Dr. Huehnergarth take over the cardiac workup at that point.
Well, and how fantastic that you could just walk down the hall and it wasn't a question of sending his records here and there and trying to get him an appointment with somebody else. So when Ed got to you, what happened?
Well, I agreed with Dr. King's concern. After hearing the story again, it really was a story of progressive worsening of shortness of breath. Even, interestingly, I think Ed had mentioned that putting a Christmas tree on the car as the Christmas season was enough to provoke pain in the chest. And so that it was enough of a red flag to say we need to take the next step. So Dr. King had already done an EKG, and the EKG wasn't well, it wasn't normal, and it was abnormal enough to tell us that we needed to move forward with things.
So if you had not been working in this collaborative setting, what might have happened to your patient?
It depends on the situation. Oftentimes patients are sometimes directed to the emergency room. Sometimes that's required, but sometimes not. It was nice to keep Mr. Williams out of the emergency room. We could do things quicker and more comfortably. Sometimes what happens is things get delayed. I mean, somebody may see primary care physician, it may be a few days to see the specialist, It may be another couple days to get the testing done. So things can get delayed, and that can increase anxiety and occasionally affect safety.
It would definitely increase my anxiety. Ed, what about you? How terrific was it to be able to get treatment right away, not to have to go home knowing there was a problem but not knowing what was going to happen next?
Well, it felt very good. Actually, when I went to see Dr. King, I thought he was going to diagnose me with walking pneumonia. So when, I don't know why I thought that, but
well,
when he told me...
we're not doctors, we can just Google.
That's right. So when I did find out that I was having problems with my heart, it felt very good that the problem was going to be taken care of right away.
So what have you done in terms of treatment and lifestyle changes?
Well, I remember the first time after I had the stent put in my heart, I had an appointment to see Dr. Huehnergarth. And he made a comment to me that really stuck with me. He says, Ed, he says, you know, your body doesn't do very well with cholesterol. He says it just produces too much. And he says by putting other stuff into your body, that is, you know, like meats and things like that, that produce their own cholesterol, that you're really just doubling up on your cholesterol. So I took that advice to heart, and for the most part, try to lead like a vegan lifestyle. So I'll give up meat and dairy, and really the only thing I do eat on an occasion will be some fish.
And so you're feeling good?
Feeling great, yeah.
That's
feeling real
good. I'm very glad to hear that. So as a primary care physician, what does this mean for you in terms of quality of care for your patients to have this kind of approach?
Well, it's great. I mean, having immediate availability of specialists and testing and everything that we have at the Polyclinic is really helpful to kind of move ahead with these things. Ed's one of many examples, so it's a good place to work.
And are there other examples that come to mind of patients who've gotten quick care as a result of this?
Oh, yes. I mean, we've had patients with kidney stones who are able to get their testing done, identify the stone, and get it addressed same day. We do the same thing with important infections or pneumonia.
And I would think for patients with heart problems, this could be perhaps even life and death.
Well, and the nice thing is there's even the connection from the clinic to the hospital. So in Ed's case, once we had determined that really this was a situation that wasn't an impending heart attack at that moment, but also something that could have evolved in a shorter period of time than the typical time course of getting through testing and such. It was easy for me to call one of my partners down at the hospital and say, let's just have Ed come on down and we'll take a look. So that's what we did, and we were able to take a look at his heart arteries and put a stent in that day. And next day, he was able to go back home.
That is remarkable, and he's done all the right things since then to take good care of himself.
Absolutely.
That takes a lot of determination. Good job, everybody, patient and doctors. For more information on the Polyclinic, please visit our website. We'll have more details for you. There's more New Day right after this.